If you've been feeling a little off lately but can't quite pinpoint why, your thyroid may be to blame. The thyroid gland is a small gland located at the base of your neck that produces hormones that regulate your metabolism. When it's not working properly, it can cause some strange symptoms that you might not think are related to your thyroid at all. In this video, we'll go over the top signs that your thyroid may not be functioning optimally, which can cause thyroid problems and what you can do about it. First of all, what does the thyroid actually do? This vital gland produces two major hormones, T3 and T4, also known as triiodothyronine and thyroxine. These hormones control the rate of your metabolism, impacting how quickly or slowly you burn calories for energy. They influence your body temperature, your heart rate, digestion, muscle strength, menstrual cycles, weight, mood, and even more. The pituitary gland at the base of your brain secretes thyroid-stimulating hormone, or TSH. When TSH is released, it signals the thyroid to produce more thyroid hormones. The thyroid has TSH receptors that bind to the TSH to trigger hormone synthesis and secretion. When the thyroid isn't working correctly, it can't make enough hormones to meet your body's needs. The result is called hypothyroidism, or an underactive thyroid gland. Without enough thyroid hormones regulating metabolism, many of your body functions start to slow down. A common cause of hypothyroidism is Hashimoto's disease, which is an autoimmune disorder that damages the thyroid. Hashimoto's causes chronic inflammation that destroys thyroid tissue over time. With fewer functioning thyroid cells, hormone production declines. Other causes may include thyroid surgery, radioactive iodine treatment, medications that suppress thyroid function, pituitary disease, pregnancy, iodine deficiency, or aging. Now let's look at some of the signals from your body that your thyroid may need support. Unexpected weight gain or difficulty losing weight are very common signs. Your metabolism isn't able to burn calories efficiently, so you may notice pounds creeping on despite eating well and exercising. You might gain weight around your stomach in particular. Constant fatigue, lack of energy, and feeling run down are also frequent symptoms. Your cells aren't getting the energy they need from food when thyroid levels are low, leaving you feeling sluggish and drowsy. You may sleep a lot but still wake up absolutely exhausted. If you're often feeling cold when others are comfortable, that's also a red flag. Your body temperature relies on your thyroid to stay around that 98.6 degrees Fahrenheit. With inadequate thyroid hormones, your skin and extremities feel cold. Hair loss or brittle, thinning hair can happen when follicles don't get enough thyroid hormones. You may see more hair than usual coming out in the shower, or your hair feeling coarse and dry. It also impacts your eyebrow and lash growth too. Unexplained constipation is another sign of hypothyroidism. Your digestive system slows down since thyroid hormones regulate digestion and gut motility. Bowel movements become less frequent and stools are harder. Other symptoms may include dry skin, thinning skin, puffy eyes or face, slower reflexes, muscle weakness, impaired memory and focus, depression, a hoarse voice, heavy periods, infertility, or even an irregular heart rate. If you're experiencing an array of these symptoms, it's wise to get your thyroid tested by a doctor. Some symptoms may be subtle at first before worsening, so early detection is always key. Your doctor can check for elevated thyroid-stimulating hormone, or TSH, on a simple blood test. This indicates your pituitary gland is releasing more TSH to try to stimulate your thyroid. Elevated TSH paired with low T3 and T4 confirms an underactive thyroid. In some cases, only T3 is low, but T4 remains normal. This is known as T3 only hypothyroidism. T4 actually converts to T3, so a T3 deficiency can still cause hypothyroid symptoms. Testing TSH, T4, and T3 will provide the full picture. Now, fortunately, hypothyroidism is usually easy to treat. The most common treatment is a daily oral synthetic thyroid hormone medication like levothyroxine. This replaces the thyroid hormones your body isn't making itself. The medication doses may need to be adjusted over time based on follow-up blood work. Thyroid lab tests should be done annually to monitor your levels. It can take several months to determine the optimal dosage for you. It can also take weeks to months to start feeling better once the treatment begins. Patience and consistency with medication is vital. Keeping up with the doctor's appointments is key to managing hypothyroidism properly. Now, aside from medication, there are natural ways to support your thyroid health. Making sure you get enough iodine, iron, selenium, zinc, and omega-3 fatty acids through your diet and quality supplements will help. These nutrients are critical for thyroid hormone synthesis. You can also reduce inflammation with anti-inflammatory foods and spices like fatty fish, turmeric, and ginger. Chronic inflammation will damage the thyroid. Next, you want to prioritize sleep, stress management, and limit your caffeine and alcohol, which will tax the thyroid gland. Chronic stress aggravates the autoimmune thyroid disorders. And last, you can try thyroid-supporting supplements like ashwagandha, vitamin B complexes, and omega-3 fatty acids. But speak to your doctor first before adding any supplements to your routine. Untreated hypothyroidism can raise cholesterol, worsen depression, cause fertility issues, and progress to life-threatening mixed edema. That's why recognizing symptoms and getting evaluated promptly is so important. With the right treatment plan, most people with hypothyroidism are able to regulate their thyroid levels and feel like themselves again. Monitoring your condition and communicating with your doctor will help you to thrive. Thanks for watching. Let me know in the comments if you have any thyroid-related questions, and we'll see you next time.